Every day, millions of Americans experience some sort of low back pain. In industrialized countries, the lifetime prevalence of experiencing low back pain is somewhere between 60 to 70%. That means that more than half of the people you know in your life will at some point make a complaint to their primary care physician, usually resulting in a referral for physical therapy. There is a huge financial burden on the healthcare industry as well, due to chronic low back pain's persistence. The cost of care can average about $8,000 per person, considering time off from work, multiple specialized physicians, and continuation of care. Even after the initial plan of care is complete, patients often return because of lack of continuation of their exercise program. It is important to note that there are several approaches to low back pain. Is it acute or chronic? And is it specific or non-specific? Specific low back pain accounts for a small amount of cases, somewhere between 1 to 15%. The reason for this is that diagnostic images do not always change the plan of care depending on the signs, symptoms, and severity of the condition of the patient. If there is no specific diagnosis, then low back pain is considered non-specific. From there, the doctor of physical therapy will do an evaluation of the patient and make the proper determination of which therapeutics to apply to regain functional limitations and reduce pain. Acute low back pain is usually the result of a traumatic event that affected the musculoskeletal system, such as a muscle strain, discal protrusion, or fracture. Chronic low back pain is not a disease, but rather a symptom that has persisted for longer than 3 months and is the result of structural damage or dysfunction within the musculoskeletal system. Low back pain can be a severely disabling condition because of its persistence and ability to discourage patients from participating in a program due to their fear of increasing pain. The minimum requirement for rehabilitation must be to regain functional limitations, but the physical therapist should be able to adjust treatment based off concerns of the patient. There are multiple treatment options for low back pain. There is a lack of evidence that strongly supports one specific treatment, but a combination of pharmacologic, physical therapies, and therapeutic modalities can be used to promote proper healing. Strengthening and flexibility exercise programs help correct deviations or weaknesses in the body by balancing the length-tension relationships. This can be an effective way to reduce low back pain and help a patient relearn activities of daily living. Balance exercise programs can also be a great way to train postural control, proprioception, and coordination. Low back pain will continue to be a huge part of the healthcare industry. It is impossible not to mention the effect of coronavirus will possibly have on the physical health status of hundreds of thousands of individuals. Being hunched over desks for longer periods of time than what was previously considered normal, sedentary lifestyles becoming more prominent, with people quarantining, and negative health status of person can all result in low back pain.